We're going to turn now to a new CDC report that says more women in their 40s are having children compared to years past. Our chief medical correspondent, Dr. Narula, joins us now to break down the new data and what it means for those thinking about starting a family. And I happen to know a lot of 40-year-old women who are in this position right now, Dr. Narula.
Exactly. Well, this CDC report basically showed that the number of births in the United States increased by about 1% from 2023 to 2024. But what declined by about 1% was something called the general fertility rate. This is the average number of children a woman of childbearing age is having. And so in 2024, that's about 1.6. Compare that to a little over 3 children in the 1960s. We've seen this trend of a declining general fertility rate worldwide. We've seen it go down about 22% since 2007. Why might that be, Rebecca? Well, a lot of women are getting married later, having kids later, choosing not to have kids. There's birth control, and then there are financial concerns. The cost of raising a child, and as you know, child care is very expensive as well. And so when they also looked at those age groups, they did see, as you mentioned, that 15 to 34-year-olds, the birth rate essentially declined. In 35 to 39-year-olds, it stayed unchanged. But in that over 40 to 44-year-old range, it increased by about 2%. So those older women are having more children.
And fertility, I know this myself, it can be a struggle no matter when you start. What's the conversation to have with your doctor?
So generally over 35 is considered advanced maternal age. And this is the time where you should be sitting down with your GYN and talking about options for fertility, talking about optimizing your status before you get pregnant. So controlling things like blood pressure, making sure your weight is where it should be, taking your prenatal vitamins, getting your screenings, your vaccinations. Your GYN may refer you to a maternal fetal medicine specialist, a high risk, depending on what risk factors you have. Once you're pregnant in that older age range, you may get more screening, more genetic testing being offered to you. And then depending on your age, if you're over 35 and have risk factors, sometimes women are given an aspirin a day to reduce the risk of preeclampsia. And also you want to talk about your birth plan. So are you someone that maybe should be delivering in a hospital because you're higher risk? Typically, again, if you're over 40, it's going to be recommended that you deliver around 39 weeks. And then let's not forget, finally, the 4th trimester, the postpartum period. We know women are at risk of maternal mortality. We talk about that a lot. So you want to pay attention to symptoms, chest pain, shortness of breath, fever, and even postpartum mental health and depression, and really have close follow-up after delivery.
So important, Dr. Narula, and something you also say is advocate for yourself. Doctors are wonderful. Let them know how you're feeling.
You have to be your biggest advocate. No one else is going to look out for you as much as you are. So you have to push, push, push.
Great conversation. Thanks, Doctor.
Crucial information there. Thank you for that.